Good day to the viewing and the listening public. I am Godfrey Brooms and this is the COVID-19 update. With me is the Minister of Health, the Honorable Dr. Frank Anthony. Dr. Anthony, thank you for joining me today. Starting things off, the immunization campaign has been expanded to include persons 18 years and older with the ultimate aim to achieve herd immunity. Minister, what prompted this decision?
Well, we are trying to immunize as many persons as possible. As you know, we started out by looking at those who would be more vulnerable, that is, persons 60 years and above. And then once we start getting more vaccines into the country, we are able to reduce that to 40 years and above. So we think it's the appropriate time now, because we have been getting a lot of calls from the public to reduce the age, and so we have gone now to 18 years and above. All the vaccines that we currently have in Guyana are being used in the adult population. And if we are really and truly going to achieve herd immunity, it means that we have to get most of our adult population being immunized. And in an effort to do so, that's why we have lowered the age.
Minister, is it true that infections have increased in younger adults?
Well, infections have always been higher in the younger population. So when we review the data that we've had of the 11,000 or so cases that we have had and people would have recovered, when we look at that data, the 20 to 25 age group, we have had in excess of 1,500 infections. The 25 to, say, 30 age group, we would have had more than 1,600 infections. And the 30 to 35 age group, again, that would have been probably about 1,200 infections. So when you look across the age spectrum, you would have seen a lot of infections in the younger group, from 20 to, say, 35. And that shows that they're active in the population. These are the ones who are going out very often. Fortunately, for many of the younger people who've had the infection, they probably would have been having a milder form of the infection. The infection you can have, a lot of people might have asymptomatic infection, mild forms. But once you start having moderate to severe forms, from that, when you're getting moderate forms and you're probably having breathing difficulties, you have to come into the hospital. So a lot of the younger folks, while they have the infection, they would not be the ones who traditionally would come to the hospital, because they're more or less having this mild form. They don't have many symptoms, and they're able, after 10 days, they get better, they recover. Our challenge over the last couple of weeks is that we have seen a few cases where younger people are coming into the hospital, and that we've started analyzing those cases. And we have also seen relatively young persons, meaning probably between 40 and so forth, who would have had some amount of comorbidities, but they have come into the hospital, had the more severe form of COVID, and then died from COVID. So this is a worrying trend, and we are examining the data to see how many cases we have had and what we can do about it. Now, one thing that definitely persons can do is making sure that once the vaccine is in your area, to go out and get the vaccine. And why that is important? That is important because vaccines, while they do not prevent you from getting the infection, if you are infected, then you get a milder form of the infection. And it also prevents, in many cases, it prevents you from being hospitalized, and therefore it can prevent you from dying from COVID. So there's a real practical reason why everyone who is 18 years and above should really go and get the vaccine, and that is to protect you from COVID and to ensure that you don't die from COVID.
Minister, if a person receives the first dose of the COVID-19 vaccine and then becomes infected with COVID-19, what are the treatment protocols for that person?
The treatment does not vary. I mean, if that happens, different vaccines, the chance of getting infected varies, right? But if after your first dose you get infected, then if it's mild infection, which in a lot of cases it would be mild infection, then it would be symptomatic treatment. So if you get a fever, we'll treat for a fever. If you get a little bit of coughing, that, they treat for that. So there's no special treatment. We haven't seen after, or if after the first dose, somebody end up with, say, moderate infection or let's say moderate to severe disease, and those would be very exceptional circumstances. If we see that, then the usual treatment, hospitalization, if there's a need for assisted breathing, that is done, and whatever medication that is necessary, that would be given. But once you have your first, because all the vaccines that we're using, they're 2-dose vaccines. So once you get your first dose and your second dose, and let's say about 7 days after the second dose, then you should be fully immunized. Now, the vaccines that we're using with the AstraZeneca, for us to get maximum efficacy between first dose and second dose, we are waiting at least for 12 weeks so that we can increase the efficacy of that vaccine by 82%. So a lot of people who have gotten their first dose AstraZeneca, most of them would now be receiving their second dose in May or June. And so they have to wait a bit. Those who have received the Sinopharm vaccine, because the time period is shorter, 28 days, many of them have started receiving their second dose already. So we have close to 600 or so persons who would have taken the Sinopharm vaccines that can be considered to be fully vaccinated, meaning they have received both doses. And with the Sputnik V that we are using, in another 2 weeks or so, most people who got the first dose of the Sputnik V would be due for their second dose. So again, a lot of these persons, because of the shorter time frame, Sputnik V between first dose to second dose, it's 28 days. So because of that shorter time frame, I think you will see a lot of people being fully immunized maybe within a month or two.
Thank you, Minister. Thus far, more than 70,000 persons have received their first dose of the COVID-19 vaccine. Our population stands at approximately 800,000 people. So that puts us at about roughly 10% of the population receiving. We know achieving herd immunity is based on the availability of the vaccines. Do you believe we can pass the halfway mark to achieve herd immunity by the end of the year?
Well, in the calculation that you're probably using, you're taking the entire population. But because these vaccines are not available to children, we'll have to take them out of the equation, right? Because they're not, they can't be considered. None of these vaccines have been, the clinical trials have been done in children, so we're not using it in the 18 and below population. So if we remove those persons from the equation, then we're probably looking at about 500,000 persons. And as of yesterday, we would have completed more than 73,000 doses of, or 73,000 persons receiving their first dose. So that would get us up a little bit higher. We are working to get as much vaccines in as possible for the entire adult population of Guyana. As you know, we have received 3,000 doses from Barbados. We then receive 80,000 doses from the Indian government, which would do for 40,000 people, both doses, right? We receive another 24,000 doses from COVAX, which would do for 12,000 persons. And then we have the Sputnik V, where we have purchased 200,000 vaccines for 200,000 people. We've also received as a donation 20,000 doses of the Sinopharm vaccine, which would be good for 10,000 people. So in our calculation, we are aiming to get as close to herd immunity as possible, and while we're still a little bit short in terms of how much more vaccine we need, we continue to tirelessly pursue acquiring vaccines so that every adult in Guyana, every person 18 years and above, would be able to get a vaccine.
Minister Anthony, Region 9 seems to be in the lead with its vaccination campaign, in spite of the fact that some communities are miles apart and the travel may be challenging. With the exception of Region 10, which we spoke about recently, how have the other regional campaigns been going?
All the regions, we still need to do a lot of work. Region 9 did exceptional work in terms of their healthcare workers, where they had 100% immunization with healthcare workers. But they still need to go a far way in terms of immunizing the population itself. And so they have started that exercise. As of yesterday, I know they went out to some of the communities. They were able to do about 200 and something immunizations. And in all the interior regions, despite the difficulty of the terrain, that they have been really working tirelessly, going out to those communities and getting those vaccines out to them. There's an additional challenge, especially with those regions, because while we go out to far-flung communities, we still have to maintain the cold chain for these vaccines at -18 and -20. So we have to keep the vaccines at that temperature while still reaching out to those far-flung communities. So the staff has been doing an exceptional job in going out, taking these vaccines, making sure that the cold chain is maintained, and of course immunizing people. And I just want to recognize their efforts in doing that. The coastal areas are easier to get to. And again, our rollout campaign in the coastal areas, we have been working at the traditional spots like our health centers and health facilities in the different regions. But we are also pleased to partner with a number of religious organizations, community organizations. So we are not only operating, say, at our health centers, but there might be other locations within communities where we'll be working from. Might be closer, more accessible to people. And in that way, we are hoping to stimulate a better response. So as you know, they keep saying globally, no one is safe until everyone is vaccinated. And we are working on that principle. And here in Guyana, each one of us, we have to encourage our friends or family to make sure that they come out and get the vaccine, because this is going to protect all of us. And once people get immunized, we are going to be able to achieve herd immunity. But it means that all of us would have to take the vaccine.
Minister Anthony, are government facilities still available for persons who may need to quarantine but may not have the space at home?
Oh yes, we have in every region, we have institutional quarantine arrangements, and we have maintained them. They're being used less frequently because people have opted to stay home, but we still have them in every region. And if there's a necessity, we can keep people in these institutions.
And lastly, Minister Carper has said that it has detected cases of the UK variant in several member states, but it did not name any of the countries. Has Guyana received any correspondence?
Well, CARFA has have started a project of doing gene sequencing, and we had sent 10 samples to CARFA, and from the results that we got back, we did not detect any we might call variants of concern. So we are working with them. We probably would be sending some more samples in the future because I guess every country would like to know what are the variants that are circulating in the country and to try to take the necessary precautions.
Thank you very much, Minister.
Good.
That was the Minister of Health, the Honorable Dr. Frank Anthony. This is the COVID-19 update. Godfrey Brooms saying goodbye for now.